Assalamualaikum warahmatullahi wabarakatuh. Ni hao, vanakkam, and welcome everyone. Thank you for participating in today's webinar with us. I am Siti Soleha. I will be your moderator for the day with my partner Mayang Sari. Hi Mayang.
Hello Soleha and hi, good day everyone.
Okay, we are from kidscoffee.co. Today we are going to talk about a rather important and serious topic, the reality of child abuse, mental and physical abuse among children. Before we get started, please write any questions you have into the chat box during the presentation. This will be collected and addressed during the Q&A session following today's presentation. Okay, I will give you a quick overview of child abuse. Every child has the right to good health and a peaceful life. At least 1,000 Malaysian children are estimated to be victims of child abuse each year, right? So child abuse is a major global issue that has a negative influence on children's physical and mental health, making it a concern for society as a whole. Mayang, do you have any ideas about the physical and mental child abuse?
Yes, Soleha, actually for me, child abuse is defined as any intentional harm or mistreatment of a child under the age of 18. Child abuse manifests itself in a variety of ways, many of which occur at the same time. Abuse of any kind is not acceptable actually when a child is purposefully physically wounded or put in danger by another person. It has an impact on their mental health actually. Alright, abuse is defined as making a harmful or improper use of. Child abuse has numerous causes and it has a severe impact on innocent youngsters, leaving deep and permanent scars. Actually, don't worry, Soleha. All of this is available today through our speakers.
Yes, we are in one mind on that. As you can see in the slide, ladies and gentlemen, there have been a few cases of child abuse in Malaysia. It began in 2004 until 2018. But I did want to talk about something that happened last year. It happened on 14 August 2021, and I'm confident that we as a Malaysians will hear about a 5-year-old girl alleged to be a victim of child abuse in Bandar Hilir, Melaka. Mayang, in this situation, the child's mom and her boyfriend are accused of abusing this girl. You know what? That girl sustained injuries after being reportedly struck with a belt. This according to preliminary findings. And after that, the child was taken to Hospital Melaka for her treatment and a medical checkup.
Oh, so sad. I can even imagine if that things happen to us, Soleha. Thank you so much for getting in touch about this.
Yeah, welcome. So, ladies and gentlemen, we hope that by the end of our time together today, you will feel more at ease and confident about the topic. We are passionate about preventing mental and physical abuse among children, and we have got a lot of great stories and lessons to share with you guys today. So, stay tuned until the completion of the webinar. Ladies and gentlemen, there are 3 goals of this webinar. First, comprehend the factors that contribute to mental and physical child abuse. Second, detect the effects of mental and physical child abuse. And the last one is an explanation on how to prevent mental and physical child abuse.
Alright. The reality of child abuse, mental and physical abuse among children is being presented today. I'm glad to welcome Dr. Mira Ayu Farhana binti Bajuri, the director of a counseling association who will present about the factors of mental and physical child abuse. Hello, Dr. Mira Ayu. How are you doing?
Hello, Mayang. Thanks, I'm very good today. How are yours?
Yeah, I'm very well, Doctor. Thanks. Okay, now turn to our next speaker, Associate Professor Nurul Ain binti Sofian, the pediatrician who will present about the effects of mental and physical child abuse. Hello, Dr. Nurul Ain. How have you been?
Hello, Maya. I am good. Thank you, Maya.
Okay. Alright, pleased to hear that, Doctor. And our last speaker, Professor Nurhani Hazwani binti Ahmad, the child psychologist of a counseling association, who will present about the intervention to prevent mental and physical child abuse. So, how's everything, Dr. Hani?
Everything is fine, Mayan. Thank you for asking.
Alright, good to know that, Doctor. Okay, ladies and gentlemen, without further ado, we will hand over the microphone to our first speakers of the day. Here with us is Dr. Mirai Farhana binti Bajuri, the director of a counseling association, who will speak about the impact and physical abuse of on children. Hello, Dr. Mira Ayu. It's great to see you here, Doctor. Okay, Doctor. Actually, what are the main causes of child abuse, Doctor?
Assalamualaikum and good day everyone. Also, I welcome to Madam Nuriza in this webinar. Before we start the discussion, let me introduce myself. My name is Dr. Mira Ayu Farhana binti Bajuri as your panel today. I'm the director of Counseling Association from Sultan Idris Education University. Thank you for inviting me. Today I would like to talk about the factor of mental and physical child abuse. Child abuse consists of any acts of commission or omission that endanger or impair a child's physical or emotional health and development. Child abuse includes any damage done to a child which cannot be reasonably explained and which is often represented by an injury or series of injury appearing to be non-accidental in nature. Okay, my first point is family crisis. Mental health issue can affect a parent's ability to function adequately, and drug or alcohol use often add of the problem. Depression, substance dependence, and personality disorder are the most frequently reported psychiatric conditions that affect parents who abuse their children. Parents with mental illness may have difficulty relating to their child, exhibit impulsive physical discipline, or fail to meet the child's emotional and developmental needs. Parents with psychotic illness make up the vast majority of parents who kill their children. Such parents make the child lose respect and have conflict with the parents. Point number 2 is deviant children. Most parents express anger and stress that the child mischievous push their patient threshold, and this led them toward taking action that was deemed inappropriate to the point of occurrences of child abuse. Many are actually the cause of the child abuse. Among them is the problem of a parent who experience work stress at work until they are taken at home, and they often release that stress to their children. As we all know, the habit of a small child always whining because it needs attention from parents. So, it is not appropriate for parents to vent their anger on those who still need parental love. As we all know, our country is hit by COVID-19, which has a big impact on working parents. This is working at home. The stress of doing work at home is very high and it requires a less comfortable environment. This puts pressure on parents who have to finish their work. Parents should be a good playing a role in controlling emotions. Here, I want to share several protective factors may lessen the likelihood of children being abused or neglected. Number 1 is caregiver who create a safe, positive relationship with children. Number 2 is caregiver who practice natural parenting skill and provide emotional support. Number 3 is families with strong social support network and stable positive relationship with the people around them. Number 4 is family where caregivers are present and interested in the child. Number 5 is community with access to safe, stable housing. Number 6, communities where families have access to high quality preschool. And the last one, communities where families have access to nurturing and safe child. Based on what I've been taught just now, factors that can contribute to the physical child abuse such as family crisis, character and disobedience of the children are also called as disobedient children. Surrounding of home social support with illness and influence of alcohol amongst parents. Therefore, children needs to be protected from any form of abuse because they are critical asset for the future nation development. Understanding factor of contribute to the child abuse is crucial in designing effort and effective strategy to overcome the problem. Children must also be equipped with appropriate value and attitude to pursue the nation goal to be further leader. Thanks, that all. I will pass back to our moderator.
Alright, Doctor. So that makes sense. This is something we are considering as well. I believe your explanation has taught us something. So essentially, Doctor, based on your first point just now about the family crisis, right? Are these patterns passed on from one generation to the next? What do you think, Doctor?
Okay, Maya. Some individuals can and do break the cycle of abuse. Resilient children share some characteristics that lead to their successful coping skills such as ability to obtain positive attention from other people. Adequate communication skill, average intelligence, a caring attitude, a desire to achieve, a belief in self-help. Thank you, Maya.
Okay, thank you a lot, Dr. Mira Ain Farhana, for discussing this fascinating topic and the elements that contribute to child abuse. Thank you very much, Doctor. Ladies and gentlemen, now I'm passing this session to Siti Soleha.
Thank you, Mayang. So now, without wasting our time, moving along to our session, please welcome Association Professor Dr. Nurul Ain binti Sofyan, who will be speaking to us on the effects of mental and physical child abuse. Hi, Doctor.
Hi, Soleha.
Okay, so Doctor, just now we have talked about the factors of child abuse. But here, I want you to explain about the effects of mental and physical child abuse, because I believe that they can have terrible and long-term consequences, as well as negative social consequences, right? So could you tell us more about this?
All right. Assalamualaikum and good morning to Madam Noraliza, panels and audience. My name is Nurul Ain binti Sofyan and I work as a pediatrician at Sri Manjung Hospital. I am very honored and grateful to be invited to participate in this webinar and offer my knowledge and ideas. So today's topic is one that we want to discuss with the audience and need to discuss to the society. There were 7 physical impacts and 7 emotional effects of child abuse according to moderator question as well. So the first one, as you can see on the slide, the first one is limb deformities and brain injuries, bone fractures, leaving bruises and scars on the child's body. They will physically concave as not feed, and they will also often shivering for fear of being bitten. They also will easily startle when being greeted, like shock, and physically will look gloomy on their facial expression. So all of the physical effects will result in the child's body being unlikely any other normal child. And for the audience information, all of these results of this physical abuse did not arise as a result of a pamper pinch, but rather as a result of the abuser itself serious strikes to the child, either using an object or with the blows to the hands and feet. So, ladies and gentlemen, this is a reality and not a fantasy. Malaysians have seen many cases of child abuse, and as a pediatrician in a hospital, I have seen a lot, a ton, and a terrible example of cases of child abuse. In the cases, with the majority of the abuser are the children's parents. So moving along to the 7 effects of mental child abuse. As you can see on the slide, the first one is the child will be passive when they're dealing with other individuals. They will also be less talk, and the mental of the child will be depressed, think of their parents or their caregivers, and when they grows up, they will be vindictive, aggressive, and maybe sometimes they will be the abuser of their childs too. In this case, the child will lose interest in education and pay attention in the classroom because of the pain and the trauma they have to gain. So the infant, when they grow up, they will develop into a psychopath. So what I am to say here is, you are not a decent mother or father if you beat your child just wanting them to learn something, because educating does not necessitate violence. It necessitates love. It needs love. And if you physically and mentally abuse your child and believe that is your method of educating them, then you have a mental condition that demands treatment and medication. So, believe me, folks, when I say that this is a reality in our society, because it is a harmful educating culture. So I guess that's it for seven effects on mental and physical child abuse. Back to you, Miss Soleha.
Okay, Doctor, I get it. What you are saying makes sense to me. We were thinking about it too. Your explanation, I believe, has imparted knowledge to us. Doctor, child abuse can have both direct and indirect effects on a person's physical and mental health, according to your explanation, right?
Yes, that's it true.
Okay, so basically, one of the effects is less talk, right? Okay, actually, I have friends in this situation. So, what will become of their lives, and how will they be able to talk confidently with people in the future if they have a less talk problem?
So it is a good question, Miss Soleha. So the first step is to make sure the abuser is separate from the child. And after that, we could see the child is acting differently and more comfortable. And the second step is the child needs to get treatment and intervention from the child psychiatrist, child psychologist, and also pediatrician. Develop the trust and skills among the children just to make sure they could build an interaction and equality and quality interaction, communication with other individuals in the future. So my best advice to parents and prospective parents out there, please, please, and please prepare yourself with parenting skills, educate yourself with uh, anger management, and provide the best parenting practices for your children. Instead of harming them, love them like no one else. They have the right to be joyful and have fun in their childhood too. So finally, I would like to everyone for listening my sharing and what I had to say. And I hope my sharing will be beneficial to all of you. So back to you, Miss Soleha.
Okay, I get what you are saying, Doctor. Thank you very much, Doctor, for your responding just now. Okay, ladies and gentlemen, let's get back to Mayang for our next speaker.
Thank you, Soleha. Okay, now everyone, if the next speaker is going to talk about the intervention to prevent mental and physical child abuse, how many tips do you think can we use to prevent abuse from happening? Can anyone answer? Can anyone respond me? Okay, I think that's uncounting, right? All right, can you guys list down 3 tips to prevent mental and physical child abuse? Anyone? Come on. Okay. Up next is Professor Nurhani Hazwani binti Ahmad, the child psychologist of a counseling association. She's going to talk to you about the intervention to prevent mental and physical child abuse.
Thank you, Mariam. I am Assalamualaikum and good afternoon to everyone. I am Professor Nohani Zanimenti Ahmad as a child psychologist. Today I'm going to talk about intervention to prevent physical and mental child abuse. Or should I say who can protect child welfare from mental and physical child abuse? As everyone knows, everyone can protect child welfare. You simply have to learn how to identify and report if you encounter it. However, some professionals are especially appropriate in an appropriate position to intervene. For example, educator, school counselor, school nurse, social worker, and special educational professional because they often maintain close relationship with the children that they encounter in their work, providing unique insight into their life and behavior. Furthermore, all these professionals are mandated importer, meaning that they are legal required to disclose any non-suspected abuse to the proper authorities. Mandated reporting laws are vary among every country. But in some countries, everyone is considered as a mandated reporter. Regardless of their profession, in all the countries, everyone is allowed to report any concern about child abuse. Alright, firstly, I'm going to talk about educators, or you should say teachers, teacher aides, and other educators. Play a vital role in preventing and responding to child abuse because they spend more time with their students than other professionals because student interaction with adults and other students, their behavior in the classroom, and their academic performance can all offer clues to their home life. These multiple avenues that teachers and educators have to, have to interact with the student, which give them opportunities to discover abuse. Secondly, school counselor. School counselors play an equally important role in identifying and reporting child abuse. For most part, students does not spend much time with a counselor as much they do with their teacher. But for the student that usually or regularly meet with school counselor, they tend to develop close relationship with their counselor, since the counselor or other mental health professional are confident with their patient. It is only natural for students to disclose their difficulty to them, including any abuse. That school nurse. Similar to school counselors, school nurse may not spend much time with students as any other educator, but they arm with additional expertise and resources that make it easier for them to identify and intervene in any cases of abuse. Nurse or nurse with a specialization in pediatric will have the necessary knowledge to deal with everyday issues and ailments such as bullying or chronic illness, as well as more complicated issues of child abuse. They may even be able to discover child abuse when treating or assisting students with one of these unrelated problems. Fifth, five, the fifth one, social worker. Social worker frequently work within the child welfare system, both in and outside school. They also deal with a number of difficulty situations that can impact children, their health, and their well-being. Furthermore, social workers often get their bachelor degree in sociology, which means that the degree covers a variety of relevant topics that can be useful in working with children, such as community responsibility, mental illness, and juvenile delinquency. Because of this diverse educational and professional experience, social workers have an incredibly unique and valuable perspective to bring to prevention and intervention in child abuse cases. Finally, special education professional. As everyone knows, children with disabilities are more vulnerable and therefore more likely to experience abuse than their peers who do not have any disability. Special education professionals and other aides who work with the children with disabilities can help protect them from abuse while advocating for their needs, because they often spend one-on-one time with each other, so they tend to know their student well and may more likely to spot any sign of abuse than any other educator. They're also likely to familiar with the fact that the children with disabilities was more likely being abused than any other their peers. Alright, that's all for me. Thank you.
Yeah, I see your point there, Prof. Now, you as a child psychologist of a counseling association, right? How the interventions to prevent mental and physical abuse of these children can be implemented in a state of COVID-19 dynamics? COVID dynamics 19 has no end, doctor. What do you think?
Alright, for your question, in order to prevent mental and physical abuse of the children can be implemented in a state of COVID-19 is that you must educate yourself on any sign of child abuse or neglect in either physical or mentally. For example, in virtual safety especially, you must ask and notice surrounding of the child itself. Thank you.
Okay, Prof, your explanation just now just very clear. And thank you so much, Prof. Hazwani, for the brilliant ideas on how to prevent child abuse in our country. Thank you so much. All right, ladies and gentlemen, to sum up this topic, preventing child abuse is not simply a matter of parents doing a better job, but rather it is about creating a context in which doing better is easier. Enlightened public policy and the replication of high-quality publicly supported intervention are only part of what is needed to successfully combat child abuse. As sociologist Robert Wootton has noted, every volunteer effort or act of compassion finds its justification not in offering solutions for society's problem, but in offering hope, both that the good society and envision is possible, that the very act of helping each other give a strength and common destiny. When the problem is owned by all individuals and communities, prevention will progress and fewer children will remain at risk. So don't go anywhere, ladies and gentlemen. We are now in the Q&A session, and I will pass this session to my partner, Siti Soleha.
Okay, back to me for Q&A session. Okay, do you guys have any questions regarding our topic? Oh, okay. Okay, looks like we have a few questions. Okay, Madam Noraliza asks, I think just now one of the panelists have shown us the signs of a child who is abused. Will the signs all be evident at the same time, or the child may show only one or two signs? Okay, maybe Dr. Mira Ayu Farhana would like to answer this question.
Can I have a second, Soleha?
Okay, maybe we go to the next question. Okay, from Shamimi Al-Hanifa, I would like to ask Dr. Nurul Ain, what is other social effects of abused children? Okay, let's hear the answer from Professor Dr. Nurul Ain.
Thank you, Ms. Soleha and Ms. Shamimi for the question. So, what is other social effects of abused children? So, if other social effects is the child will grow up being a loner. They will have the difficulty to meet some friends and to interact with other people. So that's why the children need to get treatment uh, with meeting with child psychologist or child pediatrician, just to make sure they could develop the skills to make sure the social effects could get cured. Thank you.
Okay. Can we pick one more question, madam? Okay, boleh. Okay, one question. Hi and good afternoon to all. I would like to face my question to Dr. Mira Ayu. Can we treat child maltreatment when alcohol or other drugs are a problem?
Hello, okay, I will answer the question, Ansinji. The answer is research has shown when family exhibit both of this behavior, the problem must be treated simultaneously in order to ensure a child's safety. Although any the drug dependency does not automatic. Aku getah. Very little can be done to improve parenting skill until this step is taken. It should be noted that the withdrawal experienced by parents who seen using alcohol or other drug present specific risk. The effect of withdrawal often cause parents to experience instant emotion, which may increase the likelihood of child treatment. Okay, thank you, Soleha.
Okay, thank you, Doctor. Uh, it looks like we have covered a few questions from the audience. We apologize if the panel does not respond to your question because we are running out of time. Okay, but before that, to all speakers, is there anything else you wanted to cover before we wrap up?
No,
Okay, great. Thank you, everyone. So it seems like we to exceed our limited time, so I will wrap up here. Okay.
Alright, so we appreciate you being here on behalf of kidscoffee.co and our speakers. On the final note, thank you for joining us today and have a great rest of your day. See you guys soon and bye bye, everyone.